What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, January 3rd, 2025. If you're new to my channel, this is where I do the daily virus update on all those viruses that can make us sick. Flu, RSV, norovirus, COVID, and on it goes. There's a lot of different viruses out there, and they are making a lot of people sick right now, and we do have some new data today just in that shows influenza-like illness activity in the United States is just continuing to explode. The holidays, as expected, as normally would happen, although be it before 2020, we did not have COVID in the mix. The viruses are just going bonkers right now. So, yeah, I want to stay informed with what's going on with all these viruses, news stories, data, wastewater, and everything else. Just subscribe down below. This is where I do it almost every day as needed. Give this video a thumbs up if you like the video. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Alrighty, we do have several things to talk about when it comes to news. I do have some things I want to show you about the website. I made a couple tweaks and changes. Change is a good thing. And then after that, we just have a lot of data to look at today. CDC updated everything except for the variant proportion. I don't know why we do not have a COVID variant update today. I'm pretty sure today's the day for it, right? Well, we'll refresh it again, see if it came in. Then we do have some more data from CJS continuing what he presented us yesterday. We do have the rest of the states for 2024 COVID death totals. Yeah, wait till you see that. There's still some states left on this list that have really high amounts for the last year. And, of course, we are going to take a look at a few states that did update. All right, starting off with this. The Tulsa Health Department ramps up efforts as whooping cough cases climb in Oklahoma. Health officials warning about a significant rise in whooping cough cases, with hundreds of cases in Oklahoma reported in 2024 compared to just 10 cases in 2023. So far, and they put the word so far, 2024 is over. There have been 439 cases reported, and maybe they're still waiting for the last week's worth of data. But the point is, and look at this, with 38 new reports just within the last week. That's a significant number. 439 versus 10. That is a humongous increase. Terribly concerning. In Oregon, pertussis cases, whooping cough again, highest in more than 50 years. And it says in 2024, Oregon recorded the highest number of whooping cough cases known as pertussis since 1950. About 315 of the 1,105 identified cases were recorded in Lane County, according to Oregon Health Authority. Wow, that's not good. All right, bird flu. It's starting to pop up in my state now, in snow geese. Bird flu suspected in deaths of about 200 snow geese in the Lehigh Valley. In case you don't know where that's at, that is eastern Pennsylvania. That is north of the Philadelphia area. Allentown, Bethlehem, Easton. That's considered the Lehigh Valley. It's just south of the Pocono Mountains. We did start the 2025 US HPAIA, in other words, bird flu, tracking thread for animals. I did not start the human thread yet. Soon as any news comes out about that, I will start that thread. I may even just pre-start it saying, hey, here's the tracking thread, and then as stuff comes in, it'll be added. And you can see here, bird flu suspected in the deaths of those snow geese. And there was also a report of Delaware now dealing with bird flu and snow geese. So that's a concerning turn of events. Snow geese are starting to deal with that now. Moving on now to, actually, let's stay with the website for a second, because I did want to show you the sports, in sports health. Here we go, U.S. sports illness. The NFL seems to be getting hit really hard right now. Chicago Bears are having 2 players. NFL Denver Broncos, Frank Crum is missing practice on Thursday. And then the 49ers have someone dealing with a chest illness. Baltimore Ravens have someone. Yeah, the NFL is getting hit really hard right now, and I haven't looked for today. I'm sure more stuff will pop up for sports. NBA, there's been a lot of that popping up at the end of last year, so I can't see why that would just suddenly go away. It probably won't. We'll take a look at something else from the website in just a moment. Respiratory illness on the rise in Minnesota. The Minnesota Department of Health's weekly viral respiratory illness report shows a sharp increase in emergency room visits for flu and COVID-like symptoms. It is that time of year. Maryland, doctors warned of uptick in flu, COVID, and other viruses. Once again, it's that time of year, but when it comes to COVID, it seems like it's almost always that time of year, especially in the holidays and then again in the summertime. All right, I wanted to show you something else on the website. Let's see, this was not it. All right, yes, here we go. I worked on a small change in the COVID positive archive, and keyword small change and working. It's going to be a working process. It's going to take some time. But next to each person who gets added, I'm going to start putting the date of which they tested positive or most recent positive case, because some people have several, like Whoopi Goldberg 4 times, and the Ohio governor multiple times. Here it is, right here. U.S. political figures. I think it's not only going to be easier for you, it's going to be easier for me as well. Remember we did that end of the year in review, and I was just randomly going through? Well, that sparked an idea saying, you know what? Rather than guessing when if it was a case from that particular year, or if it's a previous one that I found and added in, let's just put the date right here so you can see. Governor Phil Scott of Vermont, 12/16/2024. Ted Dans, 10/21/2024. Vice President Kamala Harris, 4/26/2022. So you can see, yes, that was added in 2024, but that's a case from 2022. Get where I'm coming from here. On and on it goes. It's going to be a work in process because there's several hundred names in the archives, and maybe I will finally finish reorganizing where some of these names actually belong as well. Something else that may be coming down the line is I may also be adding a section down at the bottom here for people who have admitted to in dealing with long COVID. So look for that coming in the near future. All right, taking a look back on something I posted yesterday, a poll. And this was one of the biggest vote count polls that I have done in a very long time. Did you or someone you know get sick over the holidays? 67.8% said yes. 32.2% said no. Here's the final tally of votes. 1,043. Yeah, it's been a while since we've seen that many. And I've also noticed on X, my engagement is up and following starting to go up again. So I don't know if it's because people are sick right now or they did something to the algorithm. I honestly don't know. I think that's interesting because for the longest time, my following and engagement and everything on X was just going down because, well, you know, the election. But moving on to this now, we were going to take a look at some of the other viruses with the UK today. We may do that over the weekend. There's a lot of things that we need to look at just yet. So UK cases this week were down by 195 or 17.5%. Weekly cases, 921. Deaths up by 8, 107. Healthcare patients admitted, 1,085. So you can see here, they are not seeing a COVID wave at this time, though it may appear that they're under testing at this point, just simply because healthcare has gone up slightly. And remember, we didn't see cases for last week, so we don't know what happened there. Healthcare sometimes lags, so they may actually, in fact, be dropping at this time, which is fantastic news. In Canada, the viral activity level for COVID is moderate. Flu A is moderate. Flu B is low. And RSV is listed at high at this time. Taking a look at what is going on for air qualities in the United States. Hopefully it will load, and the West Coast continues to have problems. The plains are having a little bit of a problem today, and portions of the Mid-Atlantic are also dealing with some problems today. Taking a look at what is going on in Pinellas County, Florida, and we do see here there are quite a few calls going on in Pinellas County, Florida, at this time. We can see here sick person, behavioral health problems, and a whole bunch of different things. Taking a look at Philadelphia yesterday, coming out of Pinellas County, Florida, and going up Interstate 95, and we find ourselves in Philadelphia, which had 778 EMS incidents reported on Thursday. A live look in at what's going on just outside of Philadelphia shows that there are some calls to be had right now in Montgomery County. I'm seeing cardiac emergency calls, respiratory emergency, head injury showing up several times, fevers showing up, and now for Chester County, Pennsylvania. Whoa, how many calls is this? This is not good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, at least 19 calls here. And I'm seeing sick person show up several times, respiratory emergency show up several times, diabetic emergency, heart problems, stroke, hypertension, injured person. Yeah, this is ridiculous. That is a lot of calls. And I got a feeling Monday of next week will be pretty similar to that, because the Monday after the holidays, it just all, for whatever reason, that does seem to happen. Taking a look at the hospital situation, I'm happy to report there are less hospitals that are dealing with diverts at this time, but we can see Chester County is a bit busy at the moment. Hey, Westchester is not. I hope that holds, but with that number of ambulance calls that you see here, I don't know that that is going to hold up. What's going on at the Paoli Hospital? I should say Paoli, but Bryn Mawr Hospital. And it looks like here there is some overcrowding ongoing as of this morning. Taking a look at New Jersey, we'll see what's going on there. And we see 1, 2, 3, 4, 5, 6 hospitals dealing with issues in New Jersey today. Taking a look at the Pennsylvania wastewater dashboard, I don't know that we finally, oh, we do. Oh, wow, I'm just seeing this for the first time. Yikes. Yeah, this is, wow, really bad. We see large increases now in the following areas. Monroe County, Pennsylvania, at both wastewater sites are now seeing large increases. Allentown is seeing just an increase. We're seeing an increase in Chester County. We're seeing an increase in Cumberland County, Carlisle. Franklin County is seeing an increase. We're seeing a large increase in Westmoreland County. And we're seeing another one up at the Westmoreland County, Armstrong County border. We're also seeing an increase in Mercer County. And we are also seeing an increase in the Bradford area. We are not seeing a decrease anywhere in the state of Pennsylvania. There are some wastewater sites that have not updated. And we are also seeing several that show no change at this time. And I want to see, can I click on these and actually view any of the chart data? Yes, the charts have come back. You can't see this, but to the very right of this chart, wow, that is just a massive increase in the Pocono Mountains region of Pennsylvania. Where else were we seeing a big increase? That one up near Armstrong, Westmoreland County. I just want to click on that real quickly, see what the chart, oh, wow, massive increase there as well. That's not good. Chester County, Pennsylvania. I don't know why that doesn't show large increase at the southern one, because that is just rapidly going up. Not good what's going on here in my state of Pennsylvania. Walgreens this week, the national positivity rate for COVID is 16.6%. Reminder, that data we just looked at for Pennsylvania, that was for COVID. Taking a look at what's going on with the COVID data nationally from the CDC, it is coming up high at this time, and I'm going to refresh this just to make sure, yes, it is coming up high. The Midwest has rapidly exploded to very high levels, but you can see the national level just to the first tier of high. Everywhere else is still moderate, but I could see more places probably turning high eventually, except for the West Coast. The West Coast may never turn high. COVID epidemic status. It is growing or likely growing across the entire country, with exceptions to Alaska and these white states that are just not estimated. Flu activity just continues to explode in the Northeast and the Midwest. It's just starting to peak in the West Coast. California, Oregon, good signs of a peak there. Take a look at Alaska. It looks like Alaska is still increasing at this time. Taking a look at emergency department visits for people diagnosed with COVID. No signs of a peak here. It is still rising. Historically, right about now would be the national peak. Not seeing it yet. It may be delayed a week this year because the wave did get a late start. All right, taking a look here, let's see if we got an update from the varying proportions for COVID, and I can't even get the page to refresh at this point. So I guess we are not going to get that. We'll try for that. Oh, here we go. Let's see. Did we get it? No. We'll check it again tomorrow. If not, it's going to be next week that we get it. All right. Take a look at this. Influenza-like illness activity map. Now, full disclaimer, and I just did a tweet with this map. Full disclaimer. Just a couple years, this purple color did not exist on this map. So the fact we are now seeing Tennessee, Alabama, Louisiana, New Mexico, Idaho, Oregon, what is that? 7? 1, 2, 3, 4, 5, 6, well, whatever. It is 6 states. Because the fact that we are now seeing 6 states in that purple color, that is very bad. But then you have the shade underneath that, which is also very high. New York City's in this, New Jersey, South Carolina, Georgia, Mississippi, Nebraska, Kansas, California, all in this. This is not good, my friends. And then we are still seeing some other places that are very high as well. You get the point here. This map has just rapidly exploded thanks to the holidays. And here it is once again. Yes, this map has really exploded. Not going to take a look at hospital occupancy. Let's see if we have anything from New York State. New York State, 1,164 new cases. Taking a look at what is going on with their hospitalizations. Oh, wow. Yep, hospitalizations have seen yet again another big increase. Nope, not peaked yet. 870 people in the hospital, 72 people in the ICU. We'll have to see if next week is higher or lower. If it is lower next week, that would mean they peaked. If it comes in higher once again, well then, they have not peaked. All right, let's take a look at some data now from CJS. I did have some states to show you. I think we're going to do that tomorrow. Taking a look here, some COVID death data totals from 2024. We talked about this, and, I never change this to Friday's virus update notes. Just forget that's there. Anywho, North Carolina last year, this was CDC data tracker, they had 1,807 new COVID deaths in 2024. A lot of people think, well, COVID, it's over with, no big deal. Well, North Carolina still had over 1,800 new deaths. North Dakota, another 90 deaths. Nebraska had 318 deaths in 2024. New Hampshire had 231 deaths in 2024. New Jersey, 613. New Mexico had 335. Nevada, 273. New York State CDC provisional counts, which the state uses for its COVID deaths, 2,713 deaths in 2024. Ohio, get this, state reporting 1,150 deaths. CDC data tracker says, no, much higher, 1,775 COVID deaths in 2024. And their total is 52,759 compared to the 44,546 the state showed. 52,000 deaths in Ohio. That's ridiculous. Oklahoma, 800 deaths added in 2024. Oregon, 559 COVID deaths. Pennsylvania, my state, wow, 2,125 deaths. Puerto Rico, 728. Rhode Island, 162. South Carolina, 880. South Dakota, 71. Tennessee, 894. Texas, last year, had another 2,701 new deaths. Utah, 222 new deaths. Virginia, 1,264 deaths. Vermont, 149 deaths. That's a lot for Vermont. Washington State, 1,057. Wisconsin, 738. West Virginia, 414. And Wyoming, 107 deaths in 2024. That, my friends, is a lot of deaths added last year when the pandemic emergency is over. They're saying it's no longer a pandemic. You name it. That is a really high number. Alrighty, folks. That does it for the Friday edition of the Virus Update. We'll have another update again tomorrow with any news that pops up. We'll take a look at those states we did not take a look at today. We may also do hospital, emergency department visits, people diagnosed with COVID. If we don't do that tomorrow, we'll do it on Sunday. Yes, there's going to be a Sunday update this week. Why? Because, well, right now we're at the peak of virus season, so you need these updates as frequent as possible. If you enjoyed this video, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Friday, and if you don't catch my weekend updates, enjoy your weekend.